Hey, I'm Lucas,
I'm Brianna.
And I'm Anne Marie.
and we did our presentation on anorexia nervosa. So anorexia, often simply called anorexia nervosa, often simply called anorexia, is an eating disorder in which characterized as an individual who has abnormally low body weight. Anorexia patients are constantly under the fear of gaining weight and having a distorted perception of their weight. How do adolescents feel about, so our research question for this presentation is we decided to ask how do adolescents feel about social media and the impact it has on their perception of their body image. The research is designed to be quantitative, to give actionable data to help reduce cases of anorexia nervosa. So really what we want to do with this research question is make it modern to help improve the current studies and really make it relatable to the modern generation of children. So the causes, you can break it down several ways, but we broke it down biological. It is still not clear what genes are involved. There may be genetic changes that make some at a higher risk of developing anorexia. Some people with genetic tendencies towards perfectionism, sensitivity, and perseverance are at higher risk of those are all traits associated with anorexia. Physiological traits are tendencies towards depression and anxiety, difficulty in handling stress, excessive worrying, and feeling scared or doubtful about the future. Perfectionism, obsessive compulsive disorder, and emotionally restrained. These are all psychological factors that may cause anorexia nervosa. The environmental would be peer pressure, may also fuel the desire to be thin, particularly among young girls. Success and worth are often equated with being thin. And this is also how we're playing in with social media, is because children today are spending more time on social media platforms like WhatsApp and Snapchat and Instagram. It's further affecting their perception and relating that towards success and worth.
So our main focus of study, of course, we want to gather a questionnaire. Our questions will include concerns about eating, weight, shape, and how social media influences those behaviors. We would gather adolescents aged 13 to 18. It would be both female and male to participate in the survey. We would also like to ask our adolescents which social media platforms they are currently using the most and for how long, because social media is constantly changing and new apps and everything are coming in. So we would really want to focus on which ones they're currently using and how it can negatively impact how they feel about themselves. So long-term side effects, anorexia goes, it's long-term osteoporosis, cardiovascular disturbances, diabetes, thyroid disorder, gastrointestinal disorders, fertility and pregnancy problems, and psychiatric disorders. Some therapeutics that we can use for anorexia is always talk to a provider, a primary care provider, psychologists, dietitians, which can help give them better information on nutrition, psychiatrists, of course, for family individual therapy, which is very important as well.
Some education and prevention. It is common for teens to worry about their weight and appearance, but looking for these signs can help with prevention. Severally limiting calories, skipping meals, continued weight loss, intense exercise, drive for perfection, difficulty concentrating, making decisions or thinking, irritability, depression, social withdrawal, fainting, dizziness, and lack of energy. Talking with and providing this information to teens and teachers will help reduce the rate of anorexia. Educating parents on the importance of yearly wellness exams with their primary care provider will also help identify anorexia patients. Lifestyle changes, stick to your treatment plan, talk to your doctor about appropriate vitamin and mineral supplements, do not isolate yourself, and resist urges to weigh yourself. Results of study, the data gained from this study will be used to create an educational resource for adolescents, parents, and teenagers to educate and help prevent anorexia from developing the teen population through social media usage. Data will help to identify which age groups are more impacted and which platforms of social media have the most influence on negative body image. And last page is our references. So
basically, our approach here was trying to modernize and relate anorexia nervosa to the everyday environment that is constantly changing for adolescents and teens today. And then based off of that research question, develop an educational resource off of quantitative data to give to parents and teachers to help them understand and look for what the children and teens in their lives are going through.
thank you.
Thank you.
Thank you. All right, we'll see how terrible that was. Dude, I messed